And today we have a very simple question. This is a question that many people have heard. Mostly when hypertensives go to hospital or when they go to clinics or when they go for checkups and their BPs are poorly controlled. One of the things the dietitian or the doctor or the physician or the nurse will ask them to do is to reduce their salt intake or even stop intake of salt at all. They would restrict you from what? Taking in salt. So our duty today or my duty today is probably let you guys know why some of the times clinicians, doctors, nurses, and health workers told their BP patients to do that. All right, but then before that, I want to elaborate on some terms I'm going to use so that we all be familiar with it and there wouldn't be any confusion as we go along. Right, so I'm going to use a particular word called intravascular and then extravascular. So intravascular, inside, vascular vessel. So inside the vessels or within the vessels. Extravascular, extra, outside, vascular vessel. So outside the vessels, right? So these are the two things I'm going to use. You understand? So I mean, it's that simple. All right. So sodium, salt is sodium chloride, right? And it has so many benefits when it comes to the body, especially when it comes to neuronal signals. What sense the signals that the brain, the signals that are sent from the brain, right? For the heart to do this, for the heart to do that, for the lungs to do this, for the kidneys to do that. All these signals come from the brain. You understand? And these things are controlled by what? Sodium channels. And sodium channels produce what we call action potential for those actions to be to happen. I mean, I don't want to bother. I've been saying I don't want to bother anyone with the chemistries and the physiologies behind. I just want the understanding. So now we know that sodium helps in neuronal signaling, right? For body activities to happen, for homeostasis to even take place. Understand? But there is a saying that too much sodium is bad, or too much of everything is bad. And it's true. I mean, to even water, when you take water too much, sometimes it all like some way, you understand? Yeah. So that's basically what the reason why doctors or nurses or health workers would say these things to their patients. Now, wherever water, sodium goes in the body or salt goes in the body, water goes. But this is what happens. The intravascular or the inside of the vessel contains fluid, contains blood, right? Now, this blood is pumped from the heart. So this is what happens. So the amount of blood the heart will pump will determine the rate of resistance from the vessels. So if I'm throwing more water, if the heart is showing more fluid through the vessels, the resistance of the vessels to hold the blood will be very high. You understand? That's what produces BP. So BP is what? The amount of blood pumped within a particular a specified period of time, that's like 1 minute, and the total resistance from the vessels to hold the blood that produces what BP. If this BP goes high persistently, then the person is diagnosed with hypertensive. Like I'm saying, heart will pump blood, vessels will restrict the movement of blood in order to hold the blood and then will distribute it to the various parts of the body. Now, if this produces pressure, if the pressure is high persistent times, then the person is likely going to be diagnosed with high blood pressure or in short hypertension. Now this is the role of sodium. Like I said, taking sodium more probably you go to hospital, you are being given sodium chloride infusions and all that. Now it's going into the vessels, and wherever sodium goes, like I said, water enters. So when it goes into the vessels, sodium will pull a lot of water into the vessels. Then what happens? Intravascular volume of the fluid, intravascular fluid will increase or volume will increase. And when it increases, it means there has been more blood or more water in the vessels. So the heart has to use a lot of power and fast. The heart has to be fast and powerful to be able to pump. And when it pumps that amount of blood or that amount of fluid, the vessels, the restriction from the vessels will be higher. Then at the end of the day, to produce what? A high blood pressure. So that's what sodium is doing. Anywhere sodium will enter or salt will enter, water will also enter. So when they enter, they increase the intravascular volume, and what happens? There is high blood pressure. Now, high blood pressure in the sense that when they increase the intravascular volume, circulatory volume increase, the supply to the various body parts will increase. The pressure in that will increase. Now, when the pressure in that increase, the whole idea about hypertension happens this way. If it persistently goes high and your kidneys are normal, if you persistently take in sodium and then the kidneys are normal, they will be able to excrete the sodium out. In other words, if sodium is coming, water will also be coming. So your blood pressure will be maintained. Now, the problem comes in when the kidneys are unable to excrete the sodium out. If they are unable to excrete the sodium out, what will happen? Sodium will be retained in the vessels. And when sodium is retained in the vessels, what happens? More fluid will be coming in. So there is intravascular volume expansion or volume increment. When intravascular volume increases, the heart has to use a lot of power to pump what? The blood, and the vessel has to use a lot of power to restrict in order to hold the fluid or the blood. Now what happens? It goes on, and then pressure will increase. So the person is then diagnosed of what? High blood pressure. So that is what sodium is doing. But like I said, sodium has so many other benefits. But if you persistently take it in a high quantity, if you take sodium in a high quantity, this is what happens. So when you go to the hospital and then your BPs are being checked and it's very high persistently, anytime you go there it's high, they put you on BP profile, your BPs are high. The next thing you are likely to be told is that you need to decrease your sodium intake or your salt intake, or probably you need to stop at all. You need to stop the intake of what? Salt. So that is basically what happens. Now, recently the WHO brought an update that about 60, 70, 80% of the cases of cerebrovascular accident you've been receiving, or in short or in simple terms, stroke, is coming from what? High salt intake, high sodium intake. That is what the WHO is saying. So you could imagine the risk at which salt is causing this kind of things. Salt is making people disabled and all of that. Sometimes some of these things are related to socialism and all of that. But hey, salt is very dangerous when it comes to BP control. You understand? When you even go to the hospitals and your BPs are high, the fluid that we will give is likely not to contain much what? Salt. It's likely not to even contain salt at all. You understand? So it tells you that salt or sodium chloride has a chance to what? Increase your BP. And when it increases your BP, a lot of your vital organs are going to be hypoperfused. You understand? They are not going to be perfused well. You understand? So at the end of the day, that is why people suffer from strokes and other things. Now, too much exposure, another thing, too much exposure of too much exposure of the brain to salt or sodium chloride is very, very, very dangerous. It produces what we call free radicals. Free radicals produce what we call stress, oxidative stress to the tissues in the brain, and then they destroy these tissues. When they destroy these tissues, the micro vessels, that's the small, small, small cerebral vessels within the brain, can rupture or can bleed. They can leak out. And when they leak out, that's basically what? Stroke. Stroke is in two forms. It's either there is a blood vessel rupture or leakage, or there is a blockage of what? A blood vessel. That's all. You understand? Yeah. So salt, when it comes to BP control, is very, very important. Now, this is coming from the European Society of Cardiology. Now, when it comes to diet management, for salt intake per day, it should be approximately 1 teaspoon per day. That should be about 2,300 milligrams. That's about 2.3 grams. 1 teaspoon per day. That should be yours. But this is the problem. Most of our foodstuffs we buy outside all contain salt already. When we come home to even prepare them, we put additional salt in them. You understand? That is going a long way to affect us. But then it might not happen now. It might happen years after. Because at the end of the day, even with BP, Someone can have a high BP for like years without noticing. It is asymptomatic. You won't show symptoms. You won't feel anything. It just will take you one day to suffer from the effect. And that one day might not even save you, you understand? So this is the advice out there. Make sure you take in less, even with a 1 teaspoon per day, make sure you take in less than that. And it's going to help you. You understand? It's going to help all of us. It's going to reduce the morbidity rate of or the prevalence rate of what? Hypertension. So please, 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 and please again, as you watch this video, as you listen to me, just make sure your salt intake is well regulated before you start suffering from all these kinds of what things. Save your kidneys. Right now, dialysis is very expensive. So if you are taking too much salt, at least this should be a prompt to you so that at the end of the day, you'll be able to regulate your salt intake very well. Once again, this is O.M.A Medical Studio. This is O.M.A Basic Emergency Tips, and we will bring you another stuff again. We are going to bring you interesting topics so that we will all be able to discuss and have an idea about the general thing. All right, so subscribe to the channel if you haven't subscribed, and make sure you hit the notification bar so that in our next video you'll be part of the first group of people that will receive the notification. All right, thank you. See you again.